Hello, everyone. Okay, so I want to give everybody an update on my journey from my ACL surgery that I had 2 months ago. 2 months ago, as of yesterday, and I'm going to try to post a picture of my like this of what my leg looks like right now, and I'll try to post it somewhere like right here. And I've never edited edited my videos before, edited my videos before. So I'm going to try to post it here. If you're just looking at my closet, apparently my editing did not go very well. And so if it did go well, you'll be looking at a picture of my leg. And then if that's the case, let me describe what you're seeing right now. So, and if not, then at the end of this video, I'm going to still show you the picture and the video that I made of my leg so you can see where I am at right now at this stage. So you'll see there's two holes at the top of my knee. That is where the camera went in, and I'm guessing where the knife or the drill probably went in. So you'll see two holes at the top of my knee, and then you'll see like an incision along my shin where they pulled the tendon or the muscle or ligament. I don't know. They pulled something out of my shin basically to make your new ACL. That's how they did it for me. Everybody's different. They could use a cadaver for some people. They could use your own body parts. They can pull it from different parts of your leg. Mine just happened to be on my shin. And I'm going to have matching ones because in 2 months, I'm going to be going through this again. So it's been 2 months since my last one. And in 2 more months, I'm going back in for my second one. So my other leg, because I tore both my ACLs on both my legs. So I have to do it one at a time so I can recover from one. So that way my leg is strong enough to support myself. And basically they want to make sure I have one good leg the whole process through. So when I get the other one done, my right leg will now be my dominant leg to help me get around and whatever during that process. But I wanted to make a little journal diary to kind of help myself know what I'm about to go through again and to kind of give myself hope, but also to tell you guys for who may be going through an ACL surgery, what to expect, what not to freak out about, and also kind of the time frames of what to expect at different, the intervals of what to expect. So with that being said, some of the things, and I have notes down here, so if you see me looking down, it's because I'm reading my notes. One of the things I would say to really be mindful of is depression. For first and foremost, when you're on a bunch of medications and you're like laid up in bed and you can't go anywhere, do anything, and you can't go, you can't drive, you can't go socialize, you're like just basically held up in a bed for a couple weeks waiting for your body to recover. That is very depressing because you feel like defeated, and you feel like you're very dependent upon other people to take care of you, to change out your urinal, to help you go to the bathroom, to like basically make you food, to help you, everything that somebody's basically helping you. And it's kind of how do you say, like it just takes a lot. It takes a lot out of your soul to give up that much so somebody else can take care of you, and especially for people who are very independent or take care of themselves and do everything for themselves. So be mindful of that. That does get better about after the first month. It gets better because then you can start going to your physical therapy. You can actually start getting out, start doing more activities, and with that, you're able to see more daylight, go out and socialize, and you can start to see more, things that are going to you're going to start seeing the progress of like the physical therapy that you're doing. So you're going to start to see, every week that you're going to get better doing certain activities. For example, I'm able to do stairs now, where 4 weeks ago, I wasn't able to do even like a 4 or 5 inch stair. And I haven't been able to do stairs for 3 months because when I had my accident and I tore both of them, my knee would buckle backwards going up a step. So I haven't done stairs in almost 3.5 months, and I just now was able to start doing them. And that's those kind of progress and those little things that you're excited to, because now I have more freedom to go places and go do things, go up a curb when I park somewhere, go into a restaurant. I'm not limited to have to always find a ramp. So it gets you excited to start seeing that you're walking normally. You don't need a cane. You don't need crutches. You feel more whole and back to what you remember your activities used to be. So those are my first few things to keep an eye out for is, the progress that you make, kudos to those, and make sure you keep record of that, and you reward yourself for those achievements, but also keep mindset of the depression that you're going to have probably for the first month. Some of the other things I want to go over that you're probably going to notice is, one moment. Okay, I'm back. I had to step away for a second. Okay, so the other things I would say that are very difficult to go through the first couple weeks, and I would say more importantly, like maybe the first week, is the pressure you're going to feel in your leg. So every time like I would stand up, and it would be like you could feel all the blood like rushing to the surgery wound area, and it would just throb. It would be like raw, like it would just, you could feel like your leg pulsating because of all the pressure from the blood just going from where you were laying, now you're standing, and you just feel it all go down to your leg. That is very uncomfortable, and you only want to like stand for a few seconds to a minute or whatever. So that's something that's I would say it goes away pretty quick. I would say after the first week, it just dissipates and goes away. So it's not going to linger very long. But it does create a problem when you have to, which is the other thing, is go to the bathroom. So imagine you're like in a leg brace, right? And your leg is like basically locked into a full like stretched out position. And when you go to the bathroom, most people sit down to go to the bathroom. And so trying to maneuver around getting up and down in a locked leg position, it's difficult. Just to like mentally picture, it's difficult. I'm not going to go into the details of like what you got to do and how it all works out, but just use your imagination. It's not easy. Okay, it's a little difficult. So that's also something to be mindful of, is that you're gonna have to figure that out, and kudos to you if you figure it out, but you got to do what you got to do. So it's an adventure, I'll say that. The other thing too is I highly recommend doing any exercises, ankle pumps, exercises that your PT they offer you. Go to them all and do not skip them. It is important to do any little bit of exercise they tell you to do. It will help the healing process, and it'll help the recovery, the journey through the recovery much faster. Do it. It's important. I personally, I'm not like a gym person, obviously, because I just, I'm not a gym person, but I've really enjoyed going to PT. The atmosphere of, and I've been to like probably 3 or 4 different PT places because of all this. And each one of them has been like a really, really fun experience. The people are great. The trainers are great. The coaches are great. Even the staff, I mean, not the staff, well, yeah, the staff is too, but the clients, even the people that are there to do the same thing you are, they're very encouraging. Like they're very, everybody's there because of a struggle, and because they're all going through physical therapy too. It's a great, good little community. And I didn't think I was actually nervous about going, because I just, I didn't know what to expect, but it wasn't that bad. And actually I enjoy going because it gives me more social time to get out and do things and work on getting better, so I don't have to go all the time. But I actually asked if I could go more often, even when I'm not like scheduled to go. I'd like to still continue to go and continue to use their equipment. So it's a good experience. I highly recommend continuing to use your PT. 1 second. Okay, sorry, I had to step away again. But I would say those are the things to look out for, and that has been my journey through this whole process. So what I'll leave you with now is I'm going to possibly be able to like edit the video into this portion. So you'll now be able to see my leg. I'm not talking in the video. It was just like outside because it was good light, and I wanted to at least, be in a good spot so I could show you guys what my surgery looks like now 2 months later. So I'll add that into the video right now, and I will talk to you guys later. Bye.